Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is on all about in newborn hypoglycemia, as this is a very important topic, and I think the nurse's prompt action and intervention is very essential to safeguard the newborn's life. And to guide us into today's discussion, I now welcome our clinical expertise and another Dr. Niranjan Garu, who is our senior consultant and neonatologist from Secunderabad unit, Yashoda Hospital. I welcome you, sir, and I think this was a very much awaited session, and we are all are privileged to have you with us today. I welcome you.
Thank you.
And going forward, just to understand from your point of view, like this is a very important, topic, and like what is the neonatal hypoglycemia, and is blood sugar below 50 considered hypoglycemia? Your insight on the same. Over to you.
As compared to hypoglycemia, there is no clear-cut definitions. For the treatment purpose, WHO has made the cutoff actually. If it is blood glucose, if it is less than 45 milligram per DL, will consider as a hypoglycemia. For according to American Academy of Pediatrics, if it is less than 40, we'll consider as a hypoglycemia. In hypoglycemia also, we make it as like one is symptomatic and asymptomatic. What symptomatic means there are like if your sugar is going less than 40, some baby will have a symptoms of hypoglycemia like lethargy, poor feeding, and high-pitched cry, seizures, and there'll be jitterness, tremors. Suddenly they'll have apnea, sudden stoppage of breathings, and maybe suddenly they'll have a cardiac arrest. These are the symptoms of hypoglycemia. If any symptoms with less than 40, immediately you should treat it. If more than 40, less than 40 without symptoms, you just give a feed for the baby. So for a treatment purpose, we made it as a 40 is the cutoff.
40 is the cutoff, 40 mg per day. Yes, a very valid update, sir. And going forward, why is it crucial to detect hypoglycemia within the first span of hours of life after birth? Like we tried to mention, little seizures activity may happen, or some brain injury or long-term issues can be seen.
See, definitely hypoglycemia very, very important. And if any hypoglycemic injury in the brain, it will cause a permanent brain damage to the babies. And
Yes.
out of like 100 babies, 10 babies, they'll have at birth like 1 to 2 hours, they'll have a transient hypoglycemias. So immediately, like any babies, if you check sugar immediately without feeding, if you check any baby after birth, then definitely they'll have hypoglycemia. You should check the blood sugar after giving the feeding. You should check the blood sugars. If you won't detect these babies, if they developed a persistent hypoglycemia, we won't detect the hypoglycemia, they'll have a serious brain damage in the occipital lobe of the brain, and it will cause a permanent brain damage, causes a poor neurodevelopmental outcome. That's why detecting the hypoglycemia is very, very important.
Very important. And going ahead again, what are the causes, or we get to find these risk factors? As I was just trying to present, obviously the diabetic mother will, have the resulting hypoglycemia baby, and small and larger for gestational age. Also, is IUGR, intrauterine growth retardation, also is a causative factor? Your valid insight of the same.
Yeah, see, not all the baby develop a hypoglycemia. There are a few very high risk babies develop a hypoglycemia. One is my babies are born to diabetic mothers. In this case, what will happen? Due to high blood sugar in the mothers, that blood sugar will transfer through placenta. It will transfer to baby, and develop a hyperinsulinism will develop, and it will cause a hypoglycemia in the newborns. And second thing is the SG IUGR babies. IUGR nothing but already the baby. The growth will be restricted. So normally in the newborns, the most utilizing part of the glucose is brain, and synthesis part is the liver. The ratio between synthesis and like utilization part is a 1:5. For example, liver is producing 10% glucose, means brain is utilizing around 50% glucose. That's why these IUGR babies, they'll have a hypoglycemia. And other risk babies like preterm babies and any baby with like very low birth weight babies, perinatal asphyxia, and some of the baby on any nutrition. If your mother is total parental nutrition, in that what will happen, they'll cause rebound hypoglycemias and all. And if a baby is getting a low GR and all, they develop a hypoglycemia. And second thing is baby is very sick babies is there. So they'll have a high utilization of glucose. And if you're not providing adequate amount of glucose, they develop hypoglycemia. And some others are taking some of the drugs like beta-2 agonists, beta blockers and all. These are the drugs. And then mother on any oral hypoglycemic drugs. And if you're giving to baby, like some babies, if you start any insulin and all, it will cause hypoglycemia to the babies.
Yes.
If any this kind of high risk babies, they have made a specific protocol. Like we should check the blood
Yes.
sugar after 2 hours, you should check, and every 6 hourly we'll monitoring up to 72 hours. And if a baby on any total parental nutritions, like every 12 hours or 8 hourly, we'll check the blood sugars up to 72 hours. We do all the blood sugar monitoring.
So I'm sure that our nurses are being trained for to observe the signs and symptoms if these babies are under observation or admitted in your care. Like we get to see poor feeding, lethargic or decreased activity. I think I'm sure that yeah, this teaching is already given to the nurses and they are great to monitor this. I think yes, yeah,
See, like very simple to pick up the babies. This babies like main things in newborn, any problem, any sepsis, any hypoglycemia, the first symptom will be refusal of feed. So
feed.
this is the very common symptoms. Another baby will be suddenly even we actually, if you won't take any proper food, or like if you won't consume
Yes,
anything, if you work for like day and night, like complete without taking any intake, will develop a lethargic, and the same thing will
yes,
happen to the baby. Suddenly they'll have lethargy, hypotonia, suddenly they'll have high pitchy cry. If it's severe hypo, for example, like if baby having hypoglycemia, still we are not detect the hypoglycemia, suddenly develop the severe symptoms, like suddenly they'll go for stoppage of breathing,
yes.
apnea, and high
Apnea.
pitchy cry, seizure. Suddenly they go for cardiac arrest also. These are the few signs and symptoms of hypoglycemia.
Yes. And as we were discussing, like a few very core fundamentals and nursing care back to back, it has to happen. And I was able to present, like, if soon after birth, as you mentioned, whether it is below 40, 45, or below 50, I think these are the protocols back to back one nurse should immediately do. And I think, yes,
See,
yeah,
we have made a specific protocol for treatment of hypoglycemia. Like we have standard protocols. Any baby with symptomatic directly will start a IV dextrose. And then if a baby is asymptomatic, for example, the baby sugar is less than 40 or
yeah,
like between 20 to 40, we make it as a 20 to 40. If it is asymptomatic, we just give a trial of feeds. And after trial of feeds, after half an hour or 1 hour, we'll check the blood sugar. If a blood sugar again it is low, again we'll go for a IV dextrose, like we'll start a GR for the babies.
yes,
If any glucose is less than 20, and then if a baby having glucose level less than 40 with symptomatic, directly we go for a 2 ml per kg dextrose will start, and followed by GR6 will start. And then every 1 hour, and then we'll monitor the sugar. If it is again baby blood sugar is coming, we'll step up the sugar from the GR6 to GR8, GR10, like that, we'll step up the GR rates. And any sugar, like for example, after going to the 12.5, if it is crossing like a 12.5, after 7 days also persistent hypoglycemia is there for the
yes,
baby, then we'll think about some alternative like causes, like kind of genetic causes,
yes,
hyperinsulinism related to pancreatic tumors, and any genetic syndromes related causing the hypoglycemia, some of like baked with Weidman syndrome, some of the inborn error metabolism and all we'll try to think about. And then we'll, according to causes, like according to causes, will treat the babies. The special drugs we'll use for treatment is hydrocortisone, diazoxide, and some of the, like, if it is any refractory tumors are causing hyperinsulinism, hypoglycemia, we go for pancreatic surgery. So the
yes.
treatment are available for hypoglycemia, so refractory hypoglycemia.
Any other initiative teaching you would like to quote here for the nurses? I think this webinar has been viewed by fresher nurses as well. As seniors will know the protocol, and I think fresher also, they try to learn by seeing them. Yes. Any other teaching points or anything? I think back to back action is very important.
Yeah. So main thing is any like basic thing is neonatology is the prevention action. Okay.
Yes.
So as soon as like preventing the infection, and preventing the hypoglycemia, preventing the hypothermia, it will give 95% outcome for the baby's action. As soon as like simple interventions like keeping the baby warm and checking the
Wow.
blood sugar. If a baby
Yes.
is not taking any feeds, just teaching the breastfeeding. This is a simple intervention will give maximum outcome to the babies, and simple intervention
Babies.
like hand washing will prevent the
Yes.
infections. Infection per
Yes.
se causing hypoglycemia will prevent. So the prevention advice I like to implement in
Yeah.
like in the NICU as well. Yeah.
Yes. Very valid update on the same. And Whenever the baby has a persistent hypoglycemia, I think we need to do this procedure called heel prick and GRBS monitoring and all. Any other challenges you get to witness or anything you would like to tell the nurses that they should be, how they should be pricking, where they should be pricking, the rotation of site, everything is very important. They should
Yeah.
wait after the prep is done. Yes.
Definitely is very, very important because many of the time, like we get high blood sugars and low blood sugars, like even because checking the proper method is very, very important. So where you'll check first thing is like, that checking sisters should have a proper training actually. Whenever
Yes.
like many sisters I have observed in NA, so they'll take the tip of the fingers and all. Like in newborns, actually, you should use a lateral side of the heel. You should use. You can see that there's an imaginary line between the lateral toe and grade toe. And the lateral
Yes.
quarter, we have to choose for the collecting the blood. And
Yes.
before collecting, you just prick the baby with gently. We should prick the lateral side of the heel, and the first blood you should wipe with a spirit, and then the glucose strip also. Many of the time, what happen they will take excess of blood, and it won't detect, and there will be less amount of blood. It will show the low sugars actually. Exact. There's a mark and all they given in the glucose strip. Exact amount of the blood if you taken, if the correct blood sugar, it will come. And then many of the time I have observed many of the time, like they will take a direct blood sugar from the cannula. Actually, they'll check the blood from the cannula. This is it's not appropriate. Why? Means
Wrong
if it is
practice.
any arterial blood is there, the sugar level will be very high. You should take
High.
it from the venous blood actually. Okay.
Yes.
And then if it is sometimes they'll like a plasma glucose sugars and all very high compared to normal venous blood. And all. So the heel prick is the better method to know the glucose level.
Yes. And rotating these sites also is very important.
Yeah.
Yes, as you discussed. Yeah. How nurses can prevent hypothermia in hypoglycemic newborns? A few core nursing care, like as skin to skin contact, the education should be given to the mother, and rest of the few core fundamentals. I think you will also agree with the same.
This hypothermia, hypoglycemia, and like infection. This is like a kind of cycle. If a baby having hypothermia and develop it, they'll have an infection. Infection will cause hypoglycemia. If you're having
Yes.
hypoglycemia, again it will cause hypothermia and infections. So the preventing hypothermia is a very, very important and crucial step in the newborns because in as soon as baby got delivered, if it is one degree Celsius rise like low below temperature, make hypothermia, it will cause 28% of mortality. The prevention of hypothermia is a very, very important. For the treatment purpose, we'll make it as a like mild, moderate, and severe hypothermia.
Yes.
So
Yes.
according to the temperature, if it is mild hypothermia means 36 to 36.4, we'll call it as a mild hypothermia. Between 32 to 35.9 degrees Celsius, we'll call it a moderate hypothermia. Less than 32,
Moderate.
we'll call it a severe hypothermia. If it
Yes.
is any mild hypothermia, baby having like any cold stress, immediately you should wrap up the baby and you should immediately start a kangaroo mother care, skin to skin contact. And you should nurse the baby with the mother only and immediately start the feeding. If a baby having any moderate hypothermia, so temperature between 32 to 35.9, if they can nurse the baby under radiant warmer, and
Yes.
then rapid rewarming is not rapid rewarming is up to 34 degrees Celsius you should do. And then if baby has not received vitamin K, you give the vitamin K. And if baby
Yes.
is taking the feeds, just give the feed for the baby. If not, baby is completely lethargic, is there, start IV fluids. If it is any severe hypothermia, less than 32 degrees Celsius is there, immediately you should take the baby to the radiant warmer. We should do the rapid rewarming up to 34 degrees Celsius, followed by slow rewarming. And even if a baby has received the vitamin K, you should give vitamin K to the baby. And then
Yes.
immediately you should start antibiotics and you should start a IV fluid. These are the treatment for mild, moderate, and severe hypothermia.
Severe hypothermia.
And
Yes.
in bedside also, like for example, if you observe babies in the room side, if you like skin to skin contact, you explain about skin to skin contact, kangaroo mother care, and then if a baby not wrapped properly, ask them to use a double cloth layer for the babies and all. In our NICU and in our postnatal world, we have made a bamboo watch and all we introduce. It is
Yes.
gives the alarms actually. For example, if a baby having hypothermia, suddenly it will give the alarm. It will give a signal to the mother, and mother will be like educate. If your mother is educated and if you know about the concept, they will immediately they wrap the baby.
The alarm is produced by the warmer or any kind of
See, this
device or
bamboo
technology.
was specially made for detecting the hypothermia. So if a baby temperature is low, see, suddenly it will give alarm. The mother will get to
Yes.
know the baby having hypothermia. Immediately she'll give attention and she will wrap the baby. So this is a new
Yes.
technique we are introducing in our NIC.
Yeah, that's very great to understand. And I think this technology should be even made available in the rooms as well because, yeah, the
Yeah, we made
education
it in Yashoda hospital. We made it in postnatal also.
everywhere.
Similarly, we are doing.
So now follow-up and what could be the follow-up care and post-discharge to the mother and parents is always important. And what would be those 3 to 4 points you would like to always educate or nurses should understand?
See, many of the people think that like once you treat the baby and then our work has done, not like that actually.
Yes.
The main thing is the follow-up is very, very important. You should educate the mother. Before follow-up, mother should be very confident. So mother should know like baby should have like should receive the breastfeeding properly before discharge. Mother should be confident about breastfeeding. We should teach about like whether baby is maintaining the temperature in the room here or not, and the baby is taking like apnea free or not. These are the things you
Yes.
need to check. And then like whether mother should be like able to confidently able to take care of the baby. You need to assess all the points. And then if
Yes.
you few other danger signs, like for example rapid breathing, the baby having
Mm,
abnormal
mm,
body movements,
mm.
any jitterness, these are the few symptoms. And suddenly baby is having bluish color and all, these are the danger signs you need to explain to the patient attenders. If you're having any of the symptoms or signs, immediately you should visit or consult a neonatologist.
And also, mothers should understand if a baby appears cold despite warm surroundings, she should always talk to the doctor or the healthcare professional. Yes. And I think that was a very little valid time of discussion. We have come to the end of the discussion. As what would be your conclusion note for the nurses who are working in NICU tertiary centers or in the level 1 tertiary centers? With this, we end the discussion. Yes, your conclusion note for the nurses.
As a neonatologist, my sincere advice for all the nurses is like the treatment for a neonatologist start from the antenatal care actually. Because
Yes,
if a good antenatal care is there, we'll get a better babies. So
yes,
antenatal care, mother should get a proper nutrition, mother should get a proper iron supplements to prevent the anemia, and then you should educate the mother about the breastfeeding from the antenatal period. And if a mother is undergoing like whether having some of the problem like preeclampsia, there'll be chance of premature deliveries. To prevent to get a good outcome, antenatal steroid practice and magnesium sulfate and all should give to the any anticipated premature birth actually. And then during the birth time actually, so proper like proper like hygienic like with hygiene we should do a resuscitation of the baby. Without sterile, if you start doing a resuscitation, baby will acquire the infection from the birth itself, and it will affect the baby. And then maintaining the temperature during the resuscitation is very, very important. And as soon as baby born, the golden hour care is very, very important. Is a very
yes,
standardized. Golden hour means there are the four components. One will be prevention of hypothermia and prevention of infection and respiratory support, and then prevention of hypoglycemia. These are the four components you should make, like you
yes,
should give it to the in the first 1 hour. That is called a golden hour. That should be maintained. And in NICU also, the main important step is hand washing. So 95% of infection will be prevented by proper hand washing.
yes.
The sister should avoid the cross before touching any baby, before doing any procedure. You should maintain a sterile techniques. And then doing a hand washing, hand hygiene is very, very important. And immediately simple attentions like regular monitoring of the babies,
Yes.
regularly checking the vitals, and timely informing the consultants. It will be very helpful. So these are the few suggestions I'll give it to our sisters.
Very valid point and very simple way you have made us understand. And I would urge all the participants and viewers, please do connect with us in www.yashodahospital.com for more updates. As we see Dr. Niranjan doing a lot of conferences and hands-on simulations. The other day, I happened to participate in NEPCON conference, and his lecture and hands-on discussions to the nursing community among the doctors were very wonderful. And as if you just go to our podium of yashoda.com, you may get to see a lot of other health talks like premature birth updates on podcast and recent advancement in premature baby care and many more topics. Yes. So we end the session, Dr. Niranjan, and thank you for your valuable time. Thank you, and we end.